Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. I'm your host, Nicole Jacinto, and today with us on the show, we have Dr. Paul 𝗂𝗏𝗏, who is a cardiology specialist. Welcome to the show, doctor.
Thank you, Nicole, for having me.
Oh, it's my pleasure, and also to the audience out there, this show is about hypertension, which a lot of us might have. And you know what? Even if you're younger, doctor, right, you could have it. So let's learn more about it. Hypertension, doctor. Let's get right to it. What exactly is hypertension, or what I guess we commonly know it as high blood pressure? Can you tell us what exactly that is in I guess in scientific terms, or just a quick overview?
Yeah, so we have what we call a normal blood pressure. So a normal blood pressure is defined as the upper number, which is systolic, of less than 120, and the diastolic, the lower number, of less than 80. So there are varying definitions of high blood pressure. So some guidelines will say 130 is high blood pressure. Some will say 140. But most guidelines do define high blood pressure as above or equal to 130 for the systolic, and 90, 80 or 90 for the diastolic. So the reason why we're defining it is because we want to really find out when to intervene. So, for example, the American guidelines will say if your blood pressure is 120/80, then it's already elevated. So the normal or optimal is less than 120. So, but the treatment threshold is about, they say 130/80. So the definition, let's just say if it's equal or above 130, then it's defined as hypertension or high blood pressure. But the treatment might differ depending on guidelines and depending on how the doctor or your doctor interprets your risk profile, ma'am.
Okay, thank you, doctor. That was a great explanation, and you touched on a lot of things that I wanted to ask you already, but perhaps we can circle back to them. When we talk about hypertension or high blood pressure, it's not just a one-off thing, right? It's a certain blood pressure that an individual has over time. Is that correct? Please correct me if I'm wrong. Jump in. Because, like, let's say today I could experience an event that excites me so much and my blood pressure could rise up high. You wouldn't automatically classify me as someone who has hypertension, right? Like, let's say today I got to dance with Madonna on stage and my blood pressure went up and I was like, of course I can't dance. But anyway, something that excites me could be a good thing or a bad thing, and my blood pressure suddenly shot up. You wouldn't classify that as somebody with hypertension. It's not a one-off thing. So actually, it's something that somebody may have over a certain period. And let's get back to that on how to actually diagnose it. And as you said, it depends on how the doctor treats the patient, how a cardiologist like yourself sees the patient, the individual, and sees how this blood pressure is going up over time. Now, doctor, you mentioned the systolic and diastolic. I'm so glad you said that, because Okay, can you help me with the pronunciation of the machine that takes the blood pressure? Can you be the one to say it? That's fine.
Sphygmomanometer.
Okay. The sphygmomanometer. Okay, thank you.
Spig-
So
yeah,
you know,
just maybe Spigmo for short. Yeah.
in the olden days, which I lived through, it used to be this
Yeah.
either a big thing in the hospital or this thing where you open it up and there's
Mm.
they still used mercury, right? And then you'd listen with a
Correct.
scope, or you can even take it with your pulse if you're doing it so often. Like, so it's the
Mm.
first. Um, could you tell us how it's done properly when it's manual? It's like the first hardest stick. That's what will define as the systolic, or what we put in the higher number. So let's say the first
Yeah.
high, for the first strongest stick or that you hear and that you feel on is like 130. Let's pick a number, 130, and then the lowest is like the lowest stick is 70. Okay. Um, Nowadays, doctor, I have to ask you, there's a lot of automatic blood pressure machines. No, they've been around since the 90s. So how do you feel about that? Is manual better than the automatic, or have they already caught up?
Yeah. So for blood pressure monitoring, of course, the gold standard is just taking it manually. So we don't anymore use the mercurial blood pressure machines or BP apparatus because of safety reasons. For example, it is stored in a glass container, the mercury, and if the BP apparatus drops to the floor and the glass breaks, there could be a mercury spill. So we do use what we call electronic but manual, meaning we listen.
Mhm.
The reason being is that listening is actually more accurate, especially if the patient has irregular heartbeats or if the heart rate is for example, too low or too fast. Sometimes the automated one might not be too accurate. So in terms of the what we call electronic automatic blood pressure apparatus, they're already validated. Actually, there's a website by the American Heart Association. So in the Philippines, you can either go stateside, follow the Americans or the Europeans with what we call the European Society of Cardiology. So the website is validate bp.org. So you can look at for example, the brand and maybe a particular model of blood pressure apparatus that you're trying to buy. And if it's listed there, then chances are it's been validated by the American Heart Association. So it's pretty accurate. For blood pressure monitoring, you're correct. We do listen, and the first sound that we hear is what we call the systolic. And then the sound will continue, and then it will disappear, and that is what we call the diastolic or the lower number. So when the most, you already have touched on it, the most difficult screening process is to maybe screen between what we call reactive high blood pressure and true high blood pressure. So as you said, if you get too excited, maybe you're in the office and you
Yeah.
get a headache and you go to the clinic and the blood pressure taken by the nurse is high. Now you're unsure whether the high blood pressure caused the headache
Mhm.
or more commonly, the headache caused the high blood pressure. So any form of pain or stress. So, for example, you're in the office, you have a bunch of work in front of you. If you take the blood pressure, for sure it will be a little bit high.
Okay.
So ideally, for example, we tell the patient if there's a headache involved, he or she takes a pain reliever like a paracetamol. If the pain goes away and they remeasure the blood pressure and it's now normal, then most likely the second is correct. So the pain or the headache caused the high blood pressure and it's just reactive, which is quite normal. So as you said, if you're excited, maybe after watching a Taylor Swift concert and you take your blood pressure, for sure it will be elevated. It's part of the adrenaline. And if the blood pressure doesn't increase, then that means that there might be a problem with the heart.
Okay.
So when maybe you're asking, or the audience is asking, when to take the blood pressure. So ideally, it's difficult, but ideally you take it 2 hours after eating.
Mhm. 2 hours.
If the patient,
Okay.
yeah. Yeah, if the patient is hungry, the hunger will artificially increase the blood pressure. So even a non-high blood pressure individual who is hungry, if you take the blood pressure before eating, the blood pressure will be artificially be elevated. On the flip side, yeah, after eating, especially a high carb meal, so maybe a big rice diet or big rice meal, or maybe pasta or pizza, the blood pressure will go down artificially because the blood will go to the stomach and it will digest. So the blood pressure might go and low, and it might mask a true high blood pressure patient. So
Thank you.
there's
Sorry,
yeah,
I didn't mean to
there's
interrupt you.
also some tricks. So you need to plan ahead. So before 30 minutes before you take the blood pressure, you should have no coffee intake, no smoking, and no exercise, because all of those can artificially increase the blood pressure. Of course, the patient or the individual should have peed or went to the bathroom, because if the patient would like to pee, then it will artificially increase the blood pressure. The leg should not be crossed.
Yeah.
Yeah, the urge to pee can increase the blood pressure artificially. So when taking the blood pressure, if the patient or the individual is taking it himself or herself, should be in a upright, straight back position, feet flat on the floor. Yes. No crossing of the legs, because that can affect the blood pressure. Uh, if possible, no taking of the blood pressure over an article of clothing. So if the patient has a long sleeves, remove it, and don't settle for a wrist blood pressure monitor. So the blood pressure monitor that is accurate is in the cuff. So either left or right should be good. Yes, because in actuality the variance should be very small, and the patient should be resting for at least 5 minutes, not feeling anything. So if the patient just went for a walk, went to the bathroom, and then got back, took the blood pressure, it can be artificially be elevated, even if the blood pressure should have been normal because of the stress or the exercise that he just did. And then ideally, the blood pressure should be taken twice, 1 minute apart. That's the recommendation of the Americans. So that if there's a variance, then we can investigate. And then and then record, and then use that or do that for a few days. And then maybe when he goes or she goes to the doctor, bring also the BP apparatus, so that we can compare with our office BP apparatus, what they're using in the home, so that the machines are precise. So if they make a mistake, it's usually reproducible. So, but it might not be accurate. So to test the accuracy, we'll compare it with what we call the office standard, the office sphygmomanometer. Yeah,
Thank you
quite a
for
mouthful.
doctor. Okay, so great. I learned so much, doctor. And the thing is, okay, when taking blood pressure, as you said, make sure you don't do it right after you exercise, because when you exercise, you're actually trying to bring up your blood pressure goes up. Anything can make it go up, even just walking to the bathroom, holding your pee. And you did mention, if you gave an example, like if you're in the office and you have a headache and then your blood pressure goes up and you take medicine and it goes down because the medicine relieves the headache. I do want to remind people, which is like, I always remind people, when you're in pain, your blood pressure goes up. Am I correct? When you have
Correct.
some,
Yes.
whether it's a headache or foot pain, any kind of pain, like you got wounded or you have a sprain, any kind of pain can make your blood pressure go up. So I'm glad that you gave us more tips, and I asked you about manual versus automatic, and you did say don't get the wrist cuff, it's not as accurate. You gave us the website to look at, to see, like, okay, these machines, this apparatus, they have been tested, so they are more or less accurate. I remember talking to a doctor friend like in the 90s, and she was like, give it 10 up or down, because that was it.
Yeah.
They at the time. And then when you get your blood pressure, when you visit your cardiologist or doctor, I'm just recapping what you said. Bring the apparatus with you so that you can see if it's as accurate as the manual or the gold standard that you have in the office. And you did say, though, manual or taking it manually, listening to it is actually more accurate. And you did mention that you can hear other things, like, let's say, if patients have mitral valve prolapse, or a heart murmur, they may even hear that, and you can, and then a cardiologist like yourself could also discover that. And doctor, you said just jump in and correct me if I'm wrong. Anytime, like, it's best to take your blood pressure twice. Like, don't be, the patient has to be relaxed, or the person, for about 5 minutes. Like, didn't just go to the bathroom, didn't just lift something heavy, didn't just scream at someone or whatever, got angry at the news or ripped up some newspapers, something like that. And then take the blood pressure once and then wait for 1 minute and take it again, because we do see differences. And then
Correct. Yeah.
there's this phenomenon when the patient gets to the hospital, the first time the doctor takes a blood pressure, it's high because they're nervous.
Yeah.
And
Correct. Yeah.
and then so you wait and then you take it again. So we see how that goes. So thank you. Thank you for that information, doctor. And before we go to the signs and symptoms of, like, how someone might be thinking, okay, I have high blood pressure because I feel this way, or maybe their family member, their companion, or anyone, is telling them you may have high blood pressure because of, you feel these things and why you're at risk for it. Can I ask you about the values still of the systolic and diastolic? Just jump in, doctor, and correct me anytime if I'm wrong. When it's the systolic, that is when the heart pushes out the blood, right?
Yeah. Correct. The first pressure.
Pressures, okay. And then when the heart or when the blood returns back to the heart, or to the heart, right, through the arteries, or the veins, and then they go because the heart is always like pumping, like dug dug, like
Yeah.
that's a diastolic. So that's what
And
it
the
meant.
rest,
How are
yeah, the resting.
the
Yeah.
how are the beats per minute included in this? Also, why do they? I know they've recently changed the values. What do you think, though? The real value is, because before they would say, oh, if it's 140/90, that's high na. That's when you
Yeah.
start. Then it became 120/80. Oh, and then
Yeah.
no. So
Yeah. So for the Americans, it's been a while since they last changed it. So the definition of high blood pressure, actually, they have a campaign um, signifying that 130 is already high. So for the Americans, high blood pressure means a systolic blood pressure of 130 and above. For the Europeans, it's what we call a high normal, and the blood pressure that they actually identify is 140 and above systolic, and the diastolic is 90 to 99. Well, in the Americans, the diastolic is 80 to 89. Regarding therapy, there is a consensus that if the blood pressure of the patient is already 140 and above systolic and 90 and above diastolic, that's an or. So, for example, if the blood pressure is 120/90, then the 90 is already considered high. So, or a 140/70, the 140 is already considered high, even if the diastolic is 70. So, in that, there's a consensus that those patients should already be given medications if the blood pressure taken was at least twice, separate occasions, and both yielded a high number. So, in terms of the 130/80, there's a recommendation to do lifestyle modification. So, meaning if the blood pressure is 130/80, the doctor usually will predict or calculate the 10-year risk for a heart attack or a stroke. It's what we call atherosclerotic cardiovascular disease risk. Don't worry. It's part of the risk factors are smoking, cholesterol levels, sugar levels. So all of those things, your doctor will compute and see if you have at least 10% risk. So if the risk is more than 10%, then the doctor will be more aggressive and already prescribe a medication, assuming that the blood pressure was taken twice, two separate occasions. Otherwise, if the risk is less than 10, the patient may still opt for lifestyle intervention, and then maybe the doctor will give 3 months and then maybe recheck the blood pressure. If it's still elevated, then maybe that will be a time to start pharmacologic or drug therapy. Of course, all patients who will receive pharmacologic therapy or any prescription should, of course, follow lifestyle modification. It's not independent. They should go hand in hand.
Okay. So, doctor, I guess the Americans are advocating for like, let's really lower it. And
Correct.
maybe they medicate, like, look, just take the medication already to lower it to avoid all these other things. Maybe the Europeans
Yeah.
are like, you know, it's a bit, let's try some more natural things or let's not panic. And then here in the Philippines, we're somewhere in between. It really depends on your doctor. So you just basically described how you diagnose blood pressure. It's not that simple. It's not just like if you take it once or twice. I was told before that somebody should monitor their blood pressure over a period of 2 weeks every day and see that if it's consistently high, then to go to the cardiologist. Is that correct?
Yeah. So everyone, actually, the recommendation before was that everyone above 40 should have at least screening of blood pressure. So the logic is contrary to popular belief, high blood pressure usually presents with no symptoms. So we need to, yeah. So it's an old wives' tale that if you have nape pain or pain in the back of your head, that it's automatically high blood pressure, and that is the sign of a high blood pressure. So sometimes it can be true, sometimes it's not the sign or the symptom of a high blood pressure, because most of the time there's no symptom for high blood pressure, and it's only an office visit or if you screen at home that you're able to take a high blood pressure, that you're able to screen for high blood pressure.
And Dr.
So, yeah, let's go ahead.
I don't know. Thank you for telling us about an old wives' tale, and I'll ask you about a myth buster later, because some people will say, masakit yung dito ko, siguro na high blood ako. You know, you hear that all the time, but yung pala kasi nakaganyan siya sa phone niya buong araw, or it's something else. And then they'll start worrying, then they're like, naku, hindi, you know, so you don't have to panic every time you get pain in your nape or the back of your neck. And then for the cuffs, as you said, I just want to reassure, like for the cuffs, it should be in the, basically their biceps and 2 inches above.
Bicep,
I mean, put
the
your,
finger breadth.
yeah, like this. For those of our audience who can't see, I'm putting 2 fingers above the sort,
Above
the elbow,
yeah,
the elbow, which I don't know what it's called. Okay. So
the forearm.
all that information, such rich information, telling about us about the guidelines and why it's changed and how Americans have different standards from Europeans, and why here it's important that when you go for screening, as you said, sometimes there's no indication, there's no symptom, and you go for screening and find out, hey, I'm pretty relaxed, but I have a high blood pressure and I'm only like 36 or 30. That happens, right, Doc? And then, as you said, for 40 and above, you recommend that you start screening. Before I ask you about, someone who may suspect they have high blood pressure and how they may recognize that they have hypertension, or maybe it's someone someone you live with, and parang you have hypertension, aside from the fact that you're always irritated at me. Okay, so we've talked about high blood pressure and the values assigned to it, no? What is the lowest blood pressure naman someone should have? Because, I mean, we're talking about high blood pressure, but, can you just give us, we don't have to talk about low blood pressure, like, extensively, but what's the lowest that we should have? I mean, because that's also, like, dangerous if our blood pressure goes too low.
Yeah. So for the systolic, it should be above or equal to 90. So the normal blood pressure is below 120. So the normal should be about 90 to 120. So if you're talking about the diastolic, then it can be as low as 60, or it depends. For example, in an elderly, it can even go lower because of high pulse pressure. And diastolic normal is below 80. So there's special populations, for example, pregnant patients, patients with valve abnormalities that might have a low diastolic blood pressure. So the diastolic normal might vary, but the
Mm.
systolic normal is above or equal to 90.
Okay, so it's 90. So, because like if you get 90 over 60, that's still okay. But if you start
Yeah,
getting 80 over 55 and you haven't checked out with your doctor, then you go to your doctor and say, I think my blood pressure is too low. I mean,
correct.
something's going on. Okay. Thank you, doctor. Okay. Just wanted to ask that because on the other side, conversely, what's the lowest blood pressure naman that we should not panic about, but be aware of that, that there's high and there's low. Okay. So, okay, doctor, when should a person, I mean, how can individuals recognize if they have hypertension? Like, what are the common signs and symptoms? You said it can be asymptomatic, like they may not recognize it, but um, you know, uh, what if what could be the signs of having high blood pressure? Because I'm sure some people will have signs and symptoms, even though they're not fully aware yet that they have they have hypertension.
Yeah, so the most common sign is usually for patients who undergo what we call pre-employment or annual physical exam. The ECG will reveal an enlarged heart. Creatinine, which is a kidney function, will be high, meaning impaired kidney function. Or there are blood tests that show already the damage of the high blood pressure. So usually they are asymptomatic. They will have heart enlargement, some kidney damage, and then when they get to the physical exam, true enough, their blood pressure is elevated. That happens because usually it causes no symptoms. So
Okay.
some patients will have some eye problems, and then when they check with their ophthalmologist, they already have damage due to high blood pressure, and the ophthalmologist will send them to the internist or cardiologist for blood pressure screening. And true enough, they have high blood pressure. So, but as I said earlier, some will present with nape pain, and it can be a sign of high blood pressure, but it's not a very specific sign, meaning a nape pain can be caused by, as you said, looking at your gadget and having poor posture, or maybe stress, or maybe just eye problems. So for example, computer reading for a long period of time can cause eye strain and can cause some pain in the back of your head. So it's not specific, but it can be a sign. So the good news about the pandemic, at least one good news, one silver lining out of it, is that many patients now, or many individuals, are health conscious.
Mm.
They're actually going to their healthcare professionals even at the tender age of 30 plus, because they're aware that if they have illnesses and they get COVID, it might lead to a severe COVID. So we have been screening 30 plus, meaning years old patients, and we have been getting a lot of high blood pressure patients in the early 30s, which was unusual or unheard of before. So I guess it's because of the early healthcare contact that they're trying to get, or maybe because of the lifestyle or lack of exercise because of the
Oh,
pandemic.
yes.
Yeah, all of us got fat and not exercise and ate a lot.
At first, I said I'm
So
going to treadmill every day, and then it just didn't happen.
yeah, we all wanted to go out, but because of the fear of the virus, we all wanted to stay inside our houses and eat and watch Netflix and chill.
Yeah, I still like to do that on
Yeah.
occasion. Doctor, okay. So, so usually it happens like it's an incidental finding. Like if you, as you said, an eye doctor can say, hey, maybe you have high blood pressure because there's pressure in the blood vessels in your eyes or something. They can tell that it's affected you in that way, and then perhaps someone has had an executive checkup or a blood test, just like a yearly checkup. And would that be like if they got a spec 23, like the lipid profile and all that, you'd say, hey, you have high cholesterol and this and that. And for the high creatinine that you mentioned, you don't need to fast for that, but if
Yeah.
You take
Yeah.
that blood test and ask for a kidney panel, you know, you have high creatinine. That is a sign of having high blood pressure.
Yeah, could be. Yeah. So the lesson is BP apparatus are ubiquitous. You can go to, and of course, you can go to any clinic or to Makati Med if you want. And it's easy to get a BP reading. So it's not like a 30-minute procedure. It's a few, just less than a minute diagnostic test. You can have a friend who is a nurse or anyone who can, or you yourself can learn to take blood pressures or maybe buy an automatic BP apparatus. So it's very easy to screen for high blood pressure. You don't even need to go to a health institution to have it screened. But of course, for diagnosis, you need to consult your doctor. So what I'm driving at is that even at a young age of 30s, if you're maybe on the heavy side, if you're sedentary, if you have a family history, your test on the annual physical exam is abnormal, maybe you can just, on your own initiative, measure blood pressure. The blood pressure apparatuses are not very expensive. And if you get one, you can use it in your whole family. And if you have one high blood pressure patient, you can use it to monitor the blood pressure regularly.
Yes, and
Yeah.
then you also just check the others because okay, let's
Correct.
go to talking about the risk factors. Who are most or what are the most common risk factors that an individual might have? You've already mentioned family and all that. And like maybe habits or anything else that comes into, you know, somebody possibly developing hypertension over time.
Yeah, so the most common one is age. The older we get, the higher the risk. But as I said, there are a lot of young individuals, 30-ish, getting high blood pressure. So genetics also play a big role. So if you have a strong family history, both of your parents have high blood pressure, so maybe get screened earlier. Patients who are sedentary, they're not exercising, are at a higher risk. Patients who are taking too much salt in their diet or too much saturated fat, patients who are smoking, so that's a risk factor. So
How about drinking?
and patients, who are not exercising. Yeah.
How about drinking alcohol? Is that a risk factor as well?
Yes, it's also a recognized risk factor. So that's why one of the reasons or one of the interventions to lower the blood pressure is to limit oral alcohol intake.
How come they say, doctor, like if you have like a glass of wine or two, red wine a day, that it's good for your heart and your blood pressure?
Yeah, so the wine is rich in high in what we call antioxidants. So the high antioxidant level mitigates the negative effects of the alcohol. So the general dictum is for most females, because they are generally smaller, it's relegated to one drink a day, and for most males, it's just two drinks a day. One drink doesn't equate one bottle. So
Yes.
if you're if you're trying to drink wine, it's just one drink, so it's not the whole glass or not the whole bottle.
Yes.
And there's no rule for binging. So meaning some will say, doctor, I did not drink for 7 days, so you owe me what 14 drinks of
Uh,
whatever I want, so I can drink maybe one black label. So it's not that. If you don't drink that day, then you don't get another drink the following day. So it's just for most females, one drink a day. That's the maximum. And for most males, two drinks a day. So if you have a choice between beer and something with a high antioxidant value like red wine, then red wine is the better choice because of the high antioxidants.
yes. And how about other things like, okay, so there's beers, some people drink scotch or whiskey, and then there's others who drink vodka. I mean, let's talk about the quote unquote nutritional value in terms of, you know, having high antioxidants. There's tequila, there's everything. I mean, for our purposes of discussing this, and it's been in journals that having some wine or something or having a drink, is it really just relegated to wine? Because other people say, well, why not a beer a day? Why not? As you already pointed out, the wine is richer in antioxidants, and not one glass one. I mean, sorry,
Yeah.
not one glass. And then,
One bottle. Yeah.
as you said, you can't be like, I won't drink for 7 days, so therefore I'm going to drink 7 bottles this weekend. Is there like when it comes to the other drinks, do they have the same type of antioxidants at all? Or do some
Yeah.
simply it? Because people can go and research after the show. Like, I don't want you to be endorsing drinks. That's not what we're
Yeah.
doing here. But many people question this part.
Yeah. So that is the maximum. So among the drinks, for example, beer is just high in carbs. And for any alcoholic beverage, the higher the alcohol value, the more deleterious it is for heart health. So there's such a thing as what we call a holiday heart syndrome. It's when a patient ingests a lot of alcohol. So it doesn't matter whatever alcoholic drink it is. So it can be wine or it can be vodka or whatever. It depends on the alcohol intake. So, of course, some people will tolerate more alcohol than some individuals. But if they get to the threshold, it can trigger an irregular heartbeat called atrial fibrillation. And that is after the drinking binge. So, to answer the question, wine is the best in terms of antioxidants. Beers, vodka will just give you calories because of the carbs and a lot of alcohol. The higher the alcohol content, the more it is dangerous for the heart because it is an what we call a stimulant. It irritates the heart and causes irregular heartbeats called atrial fibrillation, which can lead to a lot of problems.
So, and doctor, I'm so glad you mentioned that the tolerance levels for individuals are different because some people will be like, let's say you're out with them. No, go ahead, have a glass. But actually, that person doesn't really want to. I've seen a lot of peer pressure. I've never had to be pressured to drink, but I've seen it happen. Usually, I'll just drink for that person, or something like that when it happens. But I've seen a lot of peer pressure, and it's like they don't realize they're doing it, no. But wine is good for the heart, so that's why I'm bringing this up. And then, but one person, maybe a sip or two of wine is already, and considering what if they're taking other medications, like that's already like a lot for them. Because I'm so glad you mentioned that the tolerance of individuals is different. Like one person can drink a whole bottle of scotch a night, which is not a good idea, but they can tolerate it. They don't get a bad hangover. They don't throw up. Somehow they're hungover, but they're not like getting into that category of alcohol poisoning or having an irregular heartbeat. But for some people, a glass of scotch is already a lot or too much. So thank you for bringing that up and, it coming from you. So the next time that I blab to people at a dinner or lunch, they'll say, well, Dr. 𝗑𝗶 said it. Thank you, doctor.
Thank you.
So what the role of diet and exercise, it is it really important? Like, can you tell us how important it is in preventing hypertension, or maybe even like as you said earlier, if somebody has a certain blood pressure and you think, okay, change your diet or do this and do that in 3 months and let's see if you need medication. How important really is diet and exercise?
So we're talking about if the blood pressure is maybe 130/80 and the doctor and the patient is thinking whether to take the medication or not. So if your target is below 120, which is normal, you just need about 10 millimeters mercury to lower it down. So it has been proven that if you, for example, so the recommendations are lower your salt intake. So lowering the salt intake by 1 gram a day can lower the blood pressure by 3 to 5 millimeters mercury. So on an average 2,000 kilocalories diet, that is actually the lean Filipino diet, but we don't adhere to that. We eat a lot more. The recommendation is about 2.3 grams per day of salt. So salt can be introduced in our diet, meaning, for example, we don't know that there's a lot of salt because it doesn't taste like a lot of salt, but there's actually there. So it's better if you prepare your own food so that you can actually measure the salt, or if you buy something, check the label. So if you're already at 2.3 grams per day and the blood pressure is still high, there's still value in going 1.5 grams or lower of sodium a day. So, and then of course, as you said, we also need to advocate exercise. So exercise can lower the blood pressure a bit more. So maybe the same, like 5 millimeters mercury. So this is just what we call minimum recommendation. So the Americans do recommend that we do aerobic exercise of at least 150 minutes a day. So ideally you take it or you do it every other day so that you have some form of rest in between. And or additional 2 sessions of strength training, maybe weightlifting or something. So any resistance training can help your heart. So it's either or ideally both. You do it a week. So 150 minutes of aerobic exercise and or 2 sessions of strength training or resistance training like weightlifting or pull-ups or push-ups. And then, of course, the other advice includes what we call a heart-healthy diet. So we avoid saturated fat. So if you have high blood pressure, the high blood pressure injures your blood vessels and they're prone to fat deposits. And the fat deposits can lead to a heart attack or stroke. So what are the general advice? So if you have a choice between pork or veal or beef versus chicken or fish, we'll always select the non-red meat choices, which are the chicken and fish. So the red meat like pork or beef are high in saturated fat, and we're trying to avoid that. Saturated fat means there's a lot of fat involved in so there's not much oxygen or carbon. It's a lot of fat. So the fat content is higher compared to the non-saturated fat. If we're going to go to the diet, so we choose high fiber, for example, beans or legumes or grains. So if you're taking rice or bread, maybe add wheat or something with high fiber content. And then, of course, the main culprit now is processed food. So we try to avoid processed food. So don't go to the fast food store more often than necessary. So buy in the fresh groceries or maybe canned fruits or vegetables. And if you have a choice between full fat or non-fat dairy products, of course, choose the non-fat or less fat than full fat dairy products. So basically, and lastly, of course, avoid smoking. So smoking is what we call highly modifiable risk factor for high blood pressure. And of course, the side effects or the mortality associated with it or morbidity associated with it, like heart failure or heart attack or stroke. So it's easy to say, but difficult to do. So
I have a few questions, Doctor. Please jump in and correct me if I'm wrong anytime. So, like when you were saying lower the salt intake and like it's insidious, no? Like I just want to remind people out there, and please jump in and correct me if I'm wrong. Like anything, it's not just like the salt that you use to cook. You want to put in if you're boiling something or the salt that you put on your plate, but because if we eat food like let's say adobo, and we put toyo, we put soy sauce, we forget that it's fermented in salt, and the salt, it has a high salt. I mean, there's a lot of salt. So you really do have to think about it and balance it even when you prepare it on your own. Can I ask you let's say for soft drinks or something, let's say, we're told they're high in sugar, but they also have sodium, right? So that's another source of salt. And then maybe cut down on the caffeine And as you were saying, you're talking about the meat that we eat. Avoid the red meat. Choose the leaner meat. But how about if a patient is allergic to chicken or fish? Then we go to a dietitian, a clinical dietitian. By the way, if you know any, I'd like to get a recommendation from you. That way,
Off air. Yeah.
and then it's the way we cook. It's what we eat. Then avoid processed food, which is very difficult because of the lifestyle. I mean, like, you go to work, you have no time, you buy fast food, it's available everywhere. But yes, I do love restaurants, but when you eat in them, you don't know how much salt they put, how much pepper, how much this, how much that, or how much veggie. And I did want to talk to you about exercise. So you were talking about 150 minutes a day. You could break that up
A
into
week. Yeah, a week of aerobic exercise. Yeah.
a week. I was like, 150 minutes a day, 50 minutes a week. So you can do, like, let's say Monday, Wednesday, Friday, Saturday, or Sunday aerobic exercise, and that would be walking, swimming,
Yeah.
on a treadmill or outside, running if you still want to run, that kind of thing. So what, and then they also, you said, the recommendation is like for weightlifting or weight bearing exercises twice a week, but most of us don't, a lot of people don't know how to do it exactly right.
Yeah.
So it's aerobic and anaerobic. But do you remember, like, the old style calisthenics?
Yeah. As long as you increase your heart rate, yeah,
Yeah.
it makes you a little bit short of breath, then that's already considered an aerobic exercise. So jumping jacks,
Jumping jack.
squats, yeah, you can do it. So yeah.
Doesn't it include both? I mean, there are so many new exercises and, like, getting tougher and all that. But I'd like to remind people, like, the simple old, not old, but things we learned before, like jumping jacks, reaching up, as
Yeah.
you said, push-ups. You can even try to do it against the wall,
Right.
squats, the running in place, the jump rope. Then this sounds like a Rocky movie already. But that, you can do those
Yeah.
things also, because just to encourage people, you can do that, the old stuff, like when we were kids and how we used to play, and the things we learned. So that would be part of it. But doctor, what if a person is a person with disability and they cannot walk? Or they're older and they cannot walk as much, or they have a broken bone, or they have this. What would you recommend for that person in terms of exercise? Would you
So
recommend?
ideally, yeah, ideally, if they have a facility and they can swim, swimming is actually pretty good because it doesn't strain the joints. If they cannot, for example, if they have mobility problems, they cannot move their legs, then maybe just resistance trainings using the arms can be good. There's some devices called arm or hand bicycles which they can use. It, don't get me wrong, it's just being active. You don't really need to follow the 30 minutes a day or 45 minutes, but just getting active is already good enough. Yeah. So, and the most common misconception is I don't have time. So many individuals will go to the clinic and say, Doc, I'm too busy. I cannot find time to exercise. But I will tell them, for sure, you will find time if I tell you that the cost of, for example, heart attack hospitalization is 500,000 pesos, cheaper in Makati Med with better services, maybe. But you need to find time now because in the future, when your bones are more brittle, or you're already older, definitely, and when you already have the diseases, definitely, then you will look back and say, if I did follow my doctor and went to Makati Med to have a consult, maybe I would have prevented all of this. So we tell our patients, you need to find time now. It's like a bank. Invest time now so that you will be better and live longer with better lifestyle in the future.
And do little things, like, instead of taking the elevator, if it's only 1 or 2 flights up, walk up the stairs, that kind of thing.
Yeah,
Stairs.
correct. Yeah. It's not too hard to do. So you can incorporate walking or maybe standing while in the office instead of just sitting down. So those things mean a lot. So if you're, for example, mostly sitting down, try standing on a desk and then do your office work while standing and maybe walking in place. That can, of course, increase your heart rate and be already counted as part of your exercise, daily exercise.
Doctor, can stress influence our blood pressure? And how can we mitigate this? Like, what if it's stress that's influencing, that is really the cause of someone's high blood pressure, no matter what they do, like the diet and the exercise and even the medication? I mean, is stress really a big factor? Have you found that stress is a big factor when it comes to the patients you treat?
Yeah, for sure. So that's why there's a deluge of patients with high blood pressure now at a younger age. It's because our lifestyle is becoming more complicated and stressful. So it's very difficult to counsel patients because just commuting to the office or even when driving, even the
Yeah.
traffic, early morning traffic is already stressful. Then they'll have to buy their food or prepare their food, and they realize that the expense now is really high. Just buying food might be for the whole day might be worth 500 pesos, and then working with a tough boss. So what we always say is that the stress will always be there. It's how you respond to the stress. So we usually tell them if the outcome will not matter in the next maybe 3 or 5 years, then don't stress too much about it. So for example, if you have a obnoxious coworker and the obnoxious coworker really gets into your nerves, but that coworker will not be there maybe 3 to 5 years down the road. This interaction or this irritation will not matter. Then maybe that the individual will learn to ignore the irritation or learn to live with it. So all of
You
us do experience stress. Yeah, it's
sometimes
how we deal with it that's more important. Go ahead. Yeah.
recommend a patient to see the psychologist or a psychiatrist, just like if their stress level is too high already and they need some help dealing with that? Does that come into play in helping treat?
Yes, of course. Yeah. So let's remove the stigma. Seeking the help of a psychologist or a psychiatrist doesn't mean that the patient or the person is weak. It just means that the stresses of the environment is maybe too much at that time, and anyone at any point may benefit from professional help. So these individuals are trained to help anyone. It doesn't mean that you're crazy when you're seeking the help of a psychiatrist. Everyone will benefit. I'm sure a lot of patients think that if someone they know hears that they are seeking psychiatric help, then they might be labeled as a crazy person. But it's now the modern times. It's not anymore true. So the stress of the lifestyle now is pretty overwhelming for most people, and we might need professional help, because if we don't, then maybe we'll turn into a crazy person later on.
Thank you, doctor, for talking about that and also making us aware. I mean, you're a cardiologist, but you're talking about the benefits also of psychiatry or neuro, other I can't, sorry, you're like neuropsychiatry issues. And, thank you, because it helps with the stigma. Imagine your heart doctor telling you, you see a psychiatrist also, so you can help deal with this. That's great.
Yeah.
I mean, the person as a whole, their body, their mind, their emotions, their psyche, their soul, even their spirit. And then, okay, so thank you for that, doctor, because a lot of people will really attribute it, and it's true, to the stress that we feel these days. And then, doctor, you've talked about the lifestyle changes that people can make and how to prevent even, getting to the point where you have high blood pressure. And as you said, it's kind of like a bank. You start doing it when you're younger, and then when you're older, it kind of pays off. It's like savings. And then you did mention like how people can exercise even if they're immobile, like simple things. And you talked about, just the diet also and all of that. It doesn't have to be drastic. Can you talk about medication? Just as we're about to, sorry, we're sort of running out of time, but okay. Let's talk about medication, doctor. When you prescribe medication, because a lot of people don't want to take medication. Mythbuster, can you tell us? They say, oh my God, once I start taking medication for hypertension, I can never stop na. Is that true? Is that forever
No,
na? No.
No, of course not. So if you take the doctor's advice, you exercise, do a good diet, you can of course be off the blood pressure medication. It's not true that it's a permanent one. And the second myth is that it will damage the kidneys or the lungs. High blood pressure damages the kidneys, or the liver, I mean. Yeah. So the medicines, if they lower the blood pressure, will help preserve kidney function. So it's not true that the medications that we're giving are actually toxic to the kidneys or maybe the liver. They're not. So doctors will never prescribe something that will be harmful to patients. That's
Doctor,
part of our oath.
talking
Yeah.
about how the medicine, how the waste is, I guess, how the medicine is processed and the waste, you'll say, oh, that's bad for your liver. Well, okay, the liver processes it. Sometimes the waste or is excreted through the kidneys. But as you said, actually having high blood pressure can damage your kidneys, right? Because there's a big
Correct.
hole here. I mean, and
Yeah.
you mentioned creatinine earlier. If you have high creatinine, that can be a sign that your kidneys are damaged, but that can also be a sign that you have high blood pressure because you don't know you have it pala and it's damaging your kidneys. Am I correct?
Correct. Yeah, that's one scenario wherein the patient has no symptoms. We just do a test and it's there, a sign of high blood pressure.
And doctor, a patient can also check with their doctor, right? Okay, I have kidney problems now at this age, and I want to know which medication is best that doesn't harm the kidney, and maybe you work in consultation with a nephrologist. But doctor, the medicines that you prescribe, there are 4 types. I understand. There's calcium blockers, calcium channel blockers, and then the ACE inhibitors, and the diuretics, and
Beta
the
blockers.
yeah.
Beta block.
Just tell us quickly what they do exactly so that people understand and they're not like hesitant to take the medication.
Yeah, so the calcium channel blockers are basically dilators, so they dilate the arteries. The ACE inhibitors are also dilators, so they dilate mostly the veins. They also work in preserving the kidneys when they are in danger. So the diuretics make the patient pee. So a lower circulating volume, of course, lowers the blood pressure. And the beta blockers lower the heart rate. And for some other patients, it also lowers significantly the blood pressure. So it's really mainly for lowering the heart rate. And as a bonus side effect, it lowers the blood pressure.
Because if the heart rate, that plays into like when you take your blood pressure, like your heart rate, your beats per minute is like, let's say it's 88. Okay, at a certain age, that's still okay. I'm sure your doctor can, like you can guide your patient. Some people who were athletes before have a lower heart rate. Now, if you're like at 115, I think you're having a bit of a panic attack or that's not really good. Unless you're exercising, right? Because
Yeah,
the
correct.
heart rate up and then your blood pressure will go up for a while, but eventually the thing is it will make it lower over time. Okay, I'm so glad you mentioned that, doctor. So ACE inhibitors are one of the best for kidneys. I'm just checking.
Yeah, they protect the kidneys against damage. So it's not true that they are there to harm the kidneys. We give them to protect the kidneys from the damages of high blood pressure.
Okay. So thank you for explaining about ACE inhibitors. Most started on diuretics 40s because I don't know, in the States, like first line of defense, like to take out the excess fluid. And then if I was told a few times because I was worried about someone, I said, hey, her blood pressure's kind of low. Give her more fluids and make her walk around. So that is it all. You've confirmed it. Thank you,
Yeah.
Doc. So I hope the audience watches the show over and over and over again because you gave us so much information, doctor. And then sometimes you will use medicines in combination, right? So people shouldn't be, okay, there's this and then there's that. And then you would explain it to them that this is to control this part, your blood pressure. We also, you just come into play when you talk about high blood pressure. Okay, never mind. It's another story. And I would love to interview you on that when it comes to why statins have such a bad reputation these days. And there's all this argument. Doctor, I think you explained some of the long term, the potential. If you could just maybe mention them again and then tell us how frequently we should get checked, and like what's your advice for people who have hypertension or who think they have hypertension. The floor is yours as we are going to be out of time.
So high blood pressure can lead to stroke, heart attack, or heart failure. Of course, we need to address it. In terms of monitoring the blood pressure, it depends on how the blood pressure is. For example, it's very stable. The doctor might instruct the patient to take it maybe twice a day, or maybe as often, or as maybe once a week or once a month. So you don't need to take your blood pressure very like every 15 minutes. So twice a day is usually the most frequent the doctor will tell you. And then, of course, if you're following up with any doctor, you should maybe for the first month monitor it aggressively. And then if the blood pressure is already enough or it's already stable, then monitor it less frequently. It's very important to bring the monitoring that you have at home to the doctor to show. And then, of course, as I said, very important, bring the BP apparatus. And usually the doctor will do some tests to ascertain whether the blood pressure is damaged other organs. It may be done every 6 months or every year. The tests are usually blood tests,
Blood test.
and maybe imaging of the heart or urinalysis, kidney ultrasound, things like that.
And the echo with Doppler.
Yeah.
Okay. Okay, thank you, doctor, because I keep encouraging people to get executive checkups, in
Correct.
Makati first.
They're not very expensive and they're easy to do.
I'm like, you should. They can help you long term later on. Doctor, thank you so much for being on the show. I really, for me, it's a wealth of information. We can talk about hypertension again anytime because a lot of people have it. It's the leading cause of illnesses is it the leading cause of illnesses in our country?
Yes,
I mean,
it's the top
not
cause of mortality.
yes, not just with us, but with other places as well, in other countries. And I thank you so much for taking the time and effort to be on the show. And I thank you for, putting up with all my questions. But I didn't even ask so much. You already laid it out all for us. Please come back on the show to talk about anything that you'd like that has to do with cardiology. Doctor, please do come back soon. And thank you very much for the time and effort you've spent with us here today. Is there anything, would you like to say hi to anyone before we go, doctor?
And none. Just go to Makati Med and we'll provide good service for you. Thank you, Nicole. Anytime.
Thank you, doctor. Thank you. Please do come back on the show. Everybody, we talked about hypertension today, and I hope you learned as much as I did. If not, you can play it over and over again. You know that. Thank you for watching Healthline with Makati Med. Our guest today was Dr. 𝗠𝗸𝗁, and he is a cardiology specialist in Makati Med, of course. I'm your host, Nicole Jacinto. Healthline with Makati Med will be back next week. Bye. See you then.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.